Grace and Noble.
Hello everyone, welcome back. Today we are going to talk about eye diseases. You'll be looking around and seeing people wearing eyeglasses, right? I too wear eyeglasses. Wearing eyeglasses is not about having an eye disease. It's just a spectacle correction, People who need vision correction, they just put on a lens in front of them and then they are able to see it fantastically well. 6x6 vision, as we can see. Now, talking about eye diseases, I come from Chennai, all right. Since childhood, I used to see, especially during summertime, people having pink eyes, inflamed eyes, itchy and painful, and they have this viral infection, we used to call it Madras eye at that time. Now, I don't know if they are going to call it Chennai eye. Doesn't seem very good in saying that. What actually happens in this case is conjunctivitis. Conjunctiva, we have conjunctiva, a thin layer on the eye which covers the eye. So this layer gets inflamed, infected, and it's a viral infection, it spreads around. So if you have somebody coming to you with pink eyes, it's most likely that, itchy and watery and painful, it's most likely that it's going to be an eye infection. It's going to be conjunctivitis. But in conjunctivitis also happens, if it is not a viral infection, then if it is, infected by a foreign body, not infected really, because of the utility of, a foreign body, like contact lenses, it rubs the conjunctiva quite often and it irritates and inflames the conjunctiva. This is called the GPC, giant papillary conjunctivitis. All right. So without going much into detail, it's conjunctivitis first. It's a viral infection. People who have pink eyes, and then if it is, having an inflation because of a foreign body, then it's going to be about giant papillary conjunctivitis. People who use contact lenses for a longer time or abuse contact lenses for a longer time, they will have corneal keratitis, microbial keratitis, especially, when you use solutions to clean contact lenses and lack of hygiene. If you look at their lens case, it will be horrible. So these people will have cornea inflamed. As a result of this, they will have painful eyes and they will come to you crying, I have a problem in my eye. So all you need to do is refer to the optometrist. The optometrist will send him to the ophthalmologist, and thereafter we can treat the people. And going forward, something very important which this is not on a day-to-day basis, but you have to understand these things do come once in a while, especially in old people. It's called macular degeneration, age-related macular degeneration, AMD. Macula? What's macula, by the way? Macula is a place inside the eye. Macula lutea, as it's completely said, is a place where macula is a spot, lutea means yellow, and we have concentration of cones there. It's responsible for central vision and color vision, concentration of color vision. So, as people grow old, macula degenerates. And how do we find that? People have a problem with their central vision. So this becomes a disease and that has to be treated. And here in this case, remember that when it comes to macula, you ask the person to look at something, he will say, I am not able to see something in the center, but the periphery, he's able to read something. So this is macular degeneration. But exactly opposite happens in glaucoma. In glaucoma, what happens is, people have problem at the periphery. First of all, I'll tell you what happens in glaucoma. I told you about the fluid in the chamber, which doesn't get it, it gets drained regularly. What happens is, when it doesn't get drained, the pressure builds up. Normally, the pressure inside the eye, in order to maintain the shape of the eye, there's a pressure inside that is 10 to 20 mercury. And when this fluid, which is in the chamber, doesn't get drained, then it builds up ocular hypertension. When ocular hypertension happens, then it damages the ocular nerve, the optical nerve. As a result of it, the peripheral vision gets affected. And if you are not going to treat it at the right time, then it's going to be permanent vision loss. This is called glaucoma. There's also open angle glaucoma, closed angle glaucoma. You can have a look at it later. But generally speaking, it's about an eye disease which has to be treated as soon as possible when you detect it. Diseases that happen because of the exposure to ultraviolet rays. What are ultraviolet rays? You know the spectrum, right? Which happens from violet till red, and almost from 400 to 700 nanometers. Now, ultraviolet is beyond violet. That is, from 10 to 400 nanometers is called ultraviolet rays. Very short, very effective, damaging rays. We got to be very careful about it. And these come mostly from the sun, as we are exposed to the sun. And we have this UVA, UVB, UVC rays. Very easy to remember. UVA, A for aging, B for burning, and C for cancer. UVC rays mostly get absorbed by the ozone layer, so they don't reach much on the Earth, on the planet Earth. But UVA is related to the aging. Over a period of time, as our eyes get exposed to ultraviolet UVA rays, it damages the crystalline lens behind. And what happens in this case? The lens, the protein gets denatured, and thereafter, disintegrates, and thereafter the lens becomes cloudy and you have blurred vision. The lens has to be replaced, and that's what we call it as cataract. You're right, it's cataract. Most people, it's very prevalent in India because people don't have facilities to protect their eyes, and as a result, it's important for them to use sunglasses. As a dispensing optician, you always have to advise people, even if it is cheaper or no problem at all, use sunglasses when you go outside in order for you to protect from cataract. Most people don't do that because in India especially, and most of the developing countries, people think sunglasses as an accessory, a fashion accessory. It's not like that. It's a very protective care. And in Dubai, where I am here right now, and all through the Gulf, wherever I have been, there's lots of sunglasses being sold because people understand the value of wearing sunglasses, because that is being used to protect eyes from ultraviolet rays. So I said UVA means A for aging. As you grow old, you develop cataract, and cataract means cloudy eyes, and the lens inside gets damaged, and you got to replace that. Clear? B for burning. Burning means as you get exposed to UVB rays, from the front and from the side, internal reflection, you get pterygium, which starts from P, then T, the P is silent, T-E-R-I-G-I-U-M, pterygium, and pinguicula. So pinguicula is more like an yellow spot. So you get exposed to UVB rays of ultraviolet rays, and then you get this pterygium and pinguicula. This is also prevalent, but not in so many cases. But again, using sunglasses and as a shield protects people from exposure to UV rays, right? Pterygium, pinguicula, cataract, ultraviolet rays. Clear? Easy? Right. most of the problem people develop as they grow old. If you have diabetes, yeah, then it's more likely that the first thing that gets affected in diabetes is your eye. An optometrist puts up an ophthalmoscope, looks into the eye, and he is able to detect swollen veins and hemorrhage probably. So immediately it indicates diabetic retinopathy on the retina. So this is one of those things that happens. The optometrist detects it, or the ophthalmologist, and thereafter the treatment. Retinal detachment is one of those things, as people grow old, retina can be detached. That's also a surgical process. And again, more often, you will have some people coming to you with some kind of a lump on the eyelid. It may be a stye, it may be a chalazion. Stye means it's going to be very painful. It's because the oil gland, what happens is, it enlarges and it forms some kind of a lump on the eyelids. As you see a lump, people, if they say it's very painful, so treatment, let's not talk about the treatment. It's easy to do it, it's not very difficult, but this is what, as a dispensing optician, if you see something as a lump, it might be a stye. If it is stye, it's going to be painful, otherwise it's going to be chalazion. Corneal ulcers, again, going to be ulcers on the cornea. It's going to be painful. And what else that we can talk about is in children, some eyes, both eyes will not be functioning. One eye will be functioning. The other eye, whichever, it could be right or it could be left, might not be functioning properly. That's called the lazy eye, amblyopia. And also, we see people who have squint, where they are not able to look straight. One eye will be in one corner, not looking straight. So that's called strabismus. So all these things are very generic names. Just remember it for the sake of remember it. Otherwise, no issues. All right. But there are few which is very, very important that we have to remember. Color blindness is, yes, it's increasing day by day. So, especially it is important for you to know that during driving, there is a test that people have to give for color blindness. So, and also you will find keratoconus. Cornea is in conical shape. It's like a cone. So this is called keratoconus, and that can be also addressed by trained optometrists, by some state-of-the-art contact lenses that have been made specially for keratoconus. This is it for today. We will talk about further what kind of optical equipment that is required in an optical clinic. But as far as diseases are concerned, these are the few diseases you need to remember, just to identify when you have patients coming to you. And if you have some kind of a knowledge, it's fantastic. But not to be proactively discussing anything with them, just to understand, okay, this is what it might be. All right. It's always better to sit with patients or understand, oh, this is what you have. Okay, no problem. We have some wonderful doctors in our clinic who will be taking care of you. If they are not able to do it, they will be referring you to something amazing people. And that's it. It's about caring and helping people, right? See you soon.